Well, the hearing began this morning with an impact video showing patients and healthcare workers speaking about their experiences. The children's author and broadcaster Michael Rosen was among them, who talked about their time with COVID.
I was taken straight away into intensive care and they thought I was going to die at that point. I remember lying in bed and the doctor standing by the side of my bed saying, "Will you sign a piece of paper to let us put you to sleep?" So I said, "Yes, will I wake up?" And the doctor said, "Well, we've got a 50-50 chance." And then I said, "If I don't sign," he said, "well, 0. I am a different person and my body is different from before. You see, I have permanent damage from COVID, so it's like another kind of long COVID.
Well, the lead counsel for the inquiry, Jacqueline Carey, set out what this module expects to focus on.
On the 23rd of March of 2020, when the then Prime Minister Boris Johnson told the country to lock down, the broadcast included the following phrase: "Stay at home, protect the NHS, save lives." And the focus of the inquiry's Module 3 hearings will be on some of those words and the ultimate questions: did we protect the NHS? Did we save lives? And perhaps as importantly, why did we need to protect the NHS and at what cost?
Well, our health correspondent Ashish Joshi has the latest.
This module, the module that will look at the impact of the pandemic on the healthcare system. That's every aspect of what the NHS tried to do or did do successfully and unsuccessfully through those very troubling wave after wave of this deadly virus that before then very few people had no experience of. So it's a retrospective look at the healthcare system, the decisions that were made, and ultimately how those decisions impacted the lives of thousands of people, whether they were patients or whether they were healthcare staff battling against this disease with or without the protections afforded to them at the time. Michael Rosen, the broadcaster and author, talking very powerfully about his experience as a patient in intensive care. And that's one aspect of this module, that we'll be looking at the critical care capacity in this country and those patients who were put onto those ventilators during the crisis. We also heard in that same video from a young paramedic, John from Buckinghamshire, and the impact that this developing crisis had on him as a young paramedic who had just entered into the profession, and how even to this day he is still deeply moved when he thinks back to those days on an ambulance, deciding which patients would and would not receive care. And this is what he had to say in his impact statement.
We'd done back-to-back cardiac arrests of patients under 60. And it was a man that he would have been 34. And I'd been to see him 2 days before, and he wasn't sick enough to take to hospital the day that I'd seen him. He was sick enough to go to hospital, but for the hospital at the time, he was not sick enough at that point. There was no space for people that were in that horrible middle ground of poorly but not poorly. I can't drive past that house without seeing it. And I'm not alone in that story.
So a strong opening to this morning's session. Baroness Hallett very keen to make sure that people are at the heart of this inquiry, and that's something she doesn't want to lose sight of.